I'm Dr. Sharda Jain. Today is a very happy day for all of us. It's the 1st of 2013, and you all see me as a very successful gynecologist and heading a team of a very successful ARD center in the team. I think all of us, if we are focused, we can definitely reach the position which all of us have reached. Today I should be talking about the 10 tips in success of IUI. As you all know that this is the only first therapeutic intervention for a couple who comes to you for infertility, and it has got definitely quite a good success rate. Now once we find that the first success lies in right choice based on the right facts. Once we know that the person had what is the etiology behind it, we know that patient with unexplained infertility and patient with a patient with cervical factor, and the patients have really a good success rate. But the patient with severe male infertility, patient with severe endometriosis definitely do not have that kind of a success rate. And earlier we think about the advanced ERT procedure. In such cases, things are much better. Secondly is that the second success of IUI lies in understanding your case. It pays both husband and wife. We know that the good success lies in patients who are younger, who have a short duration of infertility, and people who have good antral follicle count. The endometrium is good. In such cases, you find obviously, and the good semen count is there post-wash. In such cases, obviously the success rate of IUI is much better than in patients who are with more than 35, who have a long infertility, and patients who do not have that kind of a good ovarian response, the people who have a poor ovarian response and the endometrium is thin. In such cases, you find that the success of IUI is not so very good. So roughly what we find, and same is with the male factor. Now if you find the gentleman is young, the people who father less than 35, the chances of IUI success are much more, and the fathers who are more than 45, the chance of success of IUI becomes definitely less in such patients. Now we find, as far as the semen analysis is concerned, that if the count is pre-wash less than 10 million, the chances of success are very less. And in such cases, we should definitely offer these patients advanced ART technique. It will be much better. But we find that between 5 to 15 million count is there post-wash. In such cases, the success is pretty good. And if the count is less than 5 million, we find that the success rate markedly decreases. And so is with the age also, that if you find the people who are with advanced age, the success rate and the low semen count, the success rate in them also definitely decreases. The third secret success lies in individualization of the protocol in such patients. We know about it that clomiphene with IUI gives a success rate of almost 8 per cycle, while if we combine the gonadotrophins with clomiphene and then do the IUI, the success rate is around 10 to 12%. But if you use a pure gonadotrophin regime, then the success rate almost is 5 times, almost 18 to 20%. So I think in our practice, once we have a younger couple comes to you in less than 35, offer them cycles of CC with 2 IUIs once they have tried it outside. And if it does not succeed, then we should try to go for advanced pure gonadotrophin technique, because the success rate in such cases definitely increases. Now the fourth success lies is that how is the endometrium built up? If you find, we all know that there is a negative effect of clomiphene on the endometrial thickness, and in such cases, if you find that 5 to 15% where this negative effect of clomiphene is seen, one should utilize gonadotrophin in such patients, and once you give a gonadotrophin, obviously the endometrial response will be good. But if you we take a help of a Doppler and we find that subendometrial vascularization is not taking place, in such cases one can use aspirin, one can have a Viagra and sildenafil depending upon the experience of a particular unit. So the fifth secret lies how you are monitoring your case. The follicle monitoring, I feel you are the best person to do it. because not only you can see the follicle response, you can see the endometrial thickness, you can time your gonadotropin, what dosage has to be given, and in case if you have to add estrogen valerate, in such cases you can definitely do that. You can trigger HCG in a very big way, because not only follicle size of 18 millimeter, at that particular time you should get a urinary LH, and you find if it's positive, then in that case give an HCG trigger at that particular time. I feel the HCG trigger will be good, and then do an IUI 24 hours later. If you do an HCG trigger alone, then IUI has to be timed around 36 to 38 hours, preferably post-ovulation and not pre-ovulation. But in case if it is a donor insemination, or where there is a quality of the semen is subfertile, in such cases you should plan a 2 IUI instead of a single IUI in such cases. Now the sixth secret lies: do the right thing at the right time. It means again re-emphasizing the trigger time for the HCG is very important. You should monitor your patients not only with the follicle size by an ultrasound, you should also try to do an LH surge once the follicle is around 17 millimeters, so you can really time it. And then at what time you are doing an IUI, that is also very important, and I just now highlighted on that particular thing. Now single IUI, double IUI, we as a people, if we find that the patient is scoring everything well, then we do a single IUI, preferably post-ovulation. But if it's double IUI, we do it in a donor insemination, because I feel the cervical reservoir of the sperms is very, very important, and that can be done by one doing IUI at 16 to 18 hours, and the second IUI need to be done around 36 to 38 hours. Now the seventh secret lies, what is the lab secret? I think the lab secret is in the busy unit. One has to see to it that labeling of the semen sample is very, very crucial. I think it's much better that before hand only, the gynecologist should label the bottles and give it to them, so there is no mixing of the things. Now what I feel is a target time also, we gynecologists must remember it, from the time the specimen has been collected and from till the time the IUI is done, it should not be more than 90 hours. Secondly is that if you are getting your in-house IUI preparations are much better, but in case if you're getting it done from outside, one should see to it that within half an hour things are done, because once the seminal plasma is washed away, the capacitation process of the sperms gets started, and if it is off the acrosome cap, you may find absolutely motile sperms, but there is no pregnancy rate in such cases. So I think a couple of these things are important. The eighth secret lies in in the technique. The technique is very important. One should see to it that the patient should be relatively full bladder. Then you find that uterine cervical angle gets straightened off, things becomes easy, and if it's an easy IUI, obviously the success is going to be great. Now secondly, in such cases, one should definitely use a sterile plastic gloves, and not the ordinary gloves which we are using it, because they are definitely detrimental as to the survival of the gametes are concerned. Cervical mucus aspiration is important, and one should try to see that you load the syringe only when you are ready. Once you are ready with the things, then only you should load the syringe, and then try to see very gently, you should pass it on. The amount which has to be put inside, it has to be only 0.5 to 5, and the rest you should use in the cervical canal or in the vagina, should not do it. The question is asked, how much time of the rest is important? I think 10 minutes rest is enough. There are certain centers which are doing about 15 to 20, but the Cochrane review says the 10 minutes rest is what is important. One thing very important, on the day of IUI, if you find that ultrasound shows that egg has not ruptured, such patients should be instructed that they have to come back for a second IUI the next day. Now the ninth secret lies on the luteal support, and I think for the luteal support all of you know about it. Now there is not much controversies. It is the vaginal progestogens, and vaginal progestogens, and for that she should be definitely instructed how to do it. Now as for the 10th secret is concerned, I think the counseling at every step is important, both to the wife and to the husband, and we should also know when to stop. And I feel 3 IUIs are almost like one IVF cycle, and we should definitely do it meticulously. It is seen that after 4 IUI, the success rate definitely comes down. And we should be able to definitely say that, in such particular case, you do not require anything more, or a laparoscopy is required in such cases. And final secret lies that success lies on the integrity of the team, your analysis of data. From time to time, you should definitely analyze what works, if it does not work. And if you keep all these small things which I have just highlighted, I think one can have a success rate of very reasonable success rate, which is comparable to the best in the world. And we should not try to overstate as far the success rate of the clinic is concerned. We should be absolutely transparent, because people have to know about it. So thank you very much.